This is Mr. Howe. He is a 165-pound man, 25 years old, post-op cabbage, 5 feet 8 inches. He does have a smoking history of 10 years, 1 pack per day, and he does follow commands. So today we're going to be trying a spontaneous breathing trial on him to see how he does. Hi, Mr. Hal. I'm calling for respiratory. I want to check your wristband. He can breathe on his own. I'm going to take a listen to him. He sounds good and clear. His heart rate is 80. Respiratory rate is 20. His blood pressure is 110/65. Earlier we were going to try the spontaneous breathing trial, but we didn't due to him having pulmonary edema. I heard some crackles and he had some sputum, a thin amount, blood tinge. It was thin, blood tinge, a moderate amount. And then we got a chest x-ray on him to confirm. So we gave him some Lasix and we slowed down his fluids, and at that time I also turned his oxygen down to 40%. Right now he's on a set tidal volume of 650, a set rate of 10, a set pressure support of 10, and a set PEEP of 8. He looks like he's doing good, so we're going to put him in pressure support CPAP with a pressure support of 5 and a PEEP of 5, and we're going to monitor him to see how he does. Mr. Howe, we're going to try to do a breathing trial on you today, but first I'm going to do a couple of tests to see how you do, and then we can go from there. So I want you to lift your head off of the pillow for me if you can. Good. And I also want you to give me a thumbs up. Good job, Mr. Howe. So I'm going to suction you before we do these tests. Just to make sure your airway is clear. Let's see if I can get a good cough from you. His sedation was turned off earlier today. And we're going to put him in pressure support CPAP. And we're going to adjust the alarms. And we're also going to make sure our apnea is 20. And Mr. Howe, we're going to do a few tests on you to see if you can pass, to see if you're ready for this breathing trial. This first test is called a NIF test. So what I need you to do is suck in like you're sucking in a thick milkshake. So you're going to let your air out, and then you're going to just like that, okay? All right, on 3. 1, 2, 3. Suck, Mr. Howe. Good job. Okay, now for this second test, I'm going to let you breathe a little bit. I'm going to need you to exhale. Then you're going to let your air out. Inhale, and then I need you to blow. Okay? All right, on 3. Inhale, Mr. Howe, and blow. Good job. You passed both tests. You got a negative 30 on your NIF test, as long as it's between better than the -20, between -20 and -30, then that's good. And for your vital capacity test, you got 2.1 liters. So you did great, Mr. Howell. So I'm going to put you in pressure support CPAP. And I'm going to let you breathe on your own for a little while and see how you do. And when I come back, I'm going to check over everything and we're going to see if we can get this tube out your mouth today, okay? Alright, I'm going to leave your yank hour in case you want to suction your mouth. And also your call bell is right beside you, okay? If anything should happen and you're not breathing, this alarm will breathe. This vent will breathe for you. And we're also watching you on a monitor, making sure you don't go in a tachycardia or you're not tachypnic or anything. Alright? Alright, Mr. Howell. I also got a ABG on him earlier. Everything looked good. And we're also going to get one more on him to make sure everything is good. All of the values are in normal ranges. And his electrolytes, at first when he had pedal edema, his creatinine and bun were high, but they're okay now. So I'm going to leave for about 2 hours. Then I'm going to come back and check on him. Hi, Mr. Howell. How are you? You doing good? Great. I'm going to check your breath sounds again. Is that okay? Alright. Give me some nice deep breaths. Alright, Mr. Howell, you know that blood I got from you? Everything came back good. He had a pH of 7.38, a PaCO2 of 42, a bicarb of 22, and a PaO2 of 72, and his stats are at 95%. Alright, Mr. Howell, I'm going to let you take a break while I get an order, so that we can get this tube out your mouth, okay? Alright, you did a good job for me.